Hello, everybody, and welcome to the perfect world of finance. My name is Vera, and today, I'm going to be discussing a topic that pretty much everybody kind of knows about. It's the U.S. healthcare issues regarding cost, access, and quality. Now, one of the biggest issues in healthcare today is cost, access, and quality of healthcare. Some may know this as the iron triangle. Right there, iron triangle. We have the access, we have the quality, and we have the cost right there. So the iron triangle shows how access, quality, and cost are all intertwined with healthcare. While affecting one component of the iron triangle, it's almost impossible to not affect the other two components. Well, this makes it hard to improve all three components. So today I'll be discussing these issues and why it's important, why it's somewhat difficult to improve all three components. So let's start off with access, quality, and cost regarding to healthcare. What is it? So access is being able to access the right type of care when needed. Pretty simple, right? Quality is satisfaction of the product to the customer and is also on target with minimum variation. Now, cost is how much money people are willing to spend on healthcare, or how much money people are spending on healthcare. So, access. What's the problem and how is this problem being resolved? We have financial barriers when it comes to access, which is poverty, transportation, lack or gaps in insurance. We also have non-financial barriers, which is cultural or social competency disparities, which we have gender, race, ethnicity, and fear. When I say fear, I mean, people have a distrust in the system. They don't believe that the system is going to come through for them, which is totally understandable. Result of inadequate access, people are, less likely to receive medical care. People die prematurely. 25,000 to 50,000 people die annually because of the lack of access to care. That's a lot of people dying annually because of the lack of access to care. So something was put in place, an act was put in place recently, which is the Affordable Care Act, or ACA, or Obamacare, as people may call it. And this, what it does, it extends Medicaid coverage to millions of low-income Americans. It has two separate pieces of legislation. One is the Patient Protection and Affordable Care Act. The second one is the Healthcare and Education Reconciliation Act of 2010. So before the Affordable Care Act came along, there was limited access to health care. The Affordable Care Act puts consumers back in charge of their health care. It also gives people flexibility and the solidity they need to make conscious decisions about, their health. The Affordable Care Act expanded coverage for Americans, making it easier to have access to health care. Now, even though this is a good thing, there's also a downside to this. Increasing access to health care can either cost lots of money, which it does in many cases, or the outcome will result in reduced quality. Now, it's crazy because it's kind of a win-lose situation. You can't increase quality without increasing cost. You know what I mean? So it's kind of a win-lose situation. One is affected by the other, and it either goes up or down. So cost. What's the problem with cost, and how is it being resolved? Cost to consumers. We have insurance, we have tax codes and taxes. Because of the way we pay for insurance, it's hard to see exactly what we spend. So we don't know we're spending all this money on, healthcare, insurance, and all that other stuff because we don't really see it. So when we don't see it, it really doesn't affect us, but it does. Who pays for healthcare costs? The third party payer, which is the public payer, which is the government. And the government spends more money because most low income / poor people tend to be more sick than others. We also have the private payer, which is the employer sponsored individual plans. Um, Americans are more concerned with healthcare costs than they are with quality and access, which makes a lot of sense because healthcare can get pretty expensive. Now, I know some people, they care way more about, the cost that they're giving than the quality or access that they're receiving, which is totally understandable. A vital consideration in reducing healthcare costs is competition for the consumers between competition for the consumers' dollars between insurance companies and healthcare providers. Government spending on healthcare has grown rapidly throughout the years. In order to make the cost of care more affordable, the access of care would have to increase, or the access of care would have to increase, but the quality of care would decrease. Now that goes back to me saying that one can't be affected without another being affected. So quality. Now we have high quality care, access to care. High quality care is access to care, scientific knowledge, competent health providers, separation of financial and clinical decisions. Um, People have done studies about the evidence of lack of quality, which we have disparities, which I talked about the gender, race, ethnicity, misuse, medical errors, overuse, unnecessary services such as antibiotics. The physicians will just prescribe you antibiotics for anything. It's just a waste of money and time, and yeah. Well, problems with evaluating quality. It's not easy to quantify. Also, people have different views on what quality is. So basically, we can, to go back to what I was saying in the beginning, we can make the healthcare system cheaper, which is improving cost, but that can only happen if I reduce access in some way or reduce quality. I can improve quality, but um, that will either result in increased costs or reduced access. And of course, I can increase access as the Affordable Care Act does, but that will, either cost a lot of money, which it does, or result in reduced quality. So it's kind of a win-lose situation. You can't gain one without losing the other, which kind of sucks. So, to see if you all were listening, I have a couple of questions for you guys. So, number one, what act was put in place to better the access of communities? Just think on that for a second. If you guessed the ACA, the Affordable Care Act, you are correct. Second question, who pays for healthcare costs? Now, if you guessed the third-party payer, you are also correct. Third and last question, what three components make up the iron triangle? Now, everyone should have gotten this correct. Access, quality, and cost. If you guessed those, you are correct. Thank you, everybody, for tuning in. I hope you learned something from this about access, quality, and cost, and why it is important, and why we're having these issues today with those three things. I hope you learned something from this, and I look forward to seeing you next time. Bye.